Hello once again, everyone. Again, this is Joel Stessman with Medicom Health Interactive. Thank you all for joining us today for part of our webinar series. We're very glad to have Dan Dunlop with us today. Just a couple of housekeeping items. You are in listen-only mode, so if you do have any questions throughout the presentation, please feel free to use the chat function and go ahead and send it to me, and we will address that at the end of Dan's session. And then just a little bit of information for those of you on the call that do not know about Medicom Health. We develop online health risk assessment programs that can be branded as well as customized for your own organization. They hit a series of various service lines, whether it's cardiovascular, oncology, orthopedic, or others. And part of it is we do capture the user information for you, and it really allows you to identify those high-risk patients in your community. So when you start thinking about what you're doing for the ACA and community prevention and help lowering risk in your community and building up that prevention story, these assessments can really help you do that and track that downstream revenue as well as they go through the organization. So with that, I'm going to turn the presentation over to Dan Dunlop, who will talk more about videos and more marketing techniques as well.
Well, thank you, Joel. I appreciate the introduction, and it's always good spending an afternoon with you, even if it's we're separated by 1,500 miles or something, whatever it happens to be. You know, this presentation is about community building, and it's not something we talk a lot about in healthcare marketing. And I'm excited this afternoon because, you know, I have my own healthcare marketing community, community of friends and associates, and Joel is one of those people. And a few others are on this call today. I know Jim, Dana, Michelle. I think even my mother is probably on this call today. But anyway, thank all of you for being here today. Over the next hour, I'm going to share with you my thinking about where healthcare marketing should be going and hopefully will be going as we move forward in this really new era of healthcare or a new healthcare environment. I love sharing this study that was done by Real Simple Magazine and Huffington Post in a partnership. They surveyed over 3,500 adult women about their smartphone use. And the results were interesting. They didn't shock me, but they're just interesting to look at. And what they convey is that the world really has changed. And the way we communicate with consumers, in this case, healthcare consumers, needs to change as well. I mean, these women, how often do you check your smartphone? 39% said they're checking it every hour. 22% said it's so frequent it's impossible to count. These people are dependent upon this device. They are constantly connected, and that's really the point. Where do you typically keep your smartphone while you're sleeping? Almost 70% keep it in the bedroom. That's remarkable. Only 31% have it in some other room of the house while they're sleeping. 5% have it actually in the bed with them while they're sleeping. So they are connected wherever they go. And then to top it all off, of course, because it was Real Simple Magazine, they asked, would you rather go a month without your smartphone or a month without sex? And 48% said they would rather go a month without sex rather than have to do without their smartphone. That's how important it is for them to be connected with that outside world, and that's one of the benefits this device gives them. So the world really has changed. And how has it changed our relationships? Well, 39% said it's not really had any major impact. 24% said they feel closer to their friends. 17% said it gets them to interact more often, but not necessarily in a meaningful way. But again, it has allowed for them to be more connected through these devices. So we really do have this connected consumer today The broadcast era is over for all intents and purposes. We cannot and we should not expect to buy people's attention. I am tired of the era of healthcare marketing where we do our jobs by spewing content at a target audience. It's just not the way to go. Frankly, it's not effective and it's a waste of resources, and you're more often than not alienating an audience or just completely missing an audience. Today, the consumer is in control, and we have to recognize that, and it forces us to be far more clever and engaging in the way we go about getting their attention. Today, they decide what they view, on what kind of screen they view it, and when they view it. It's not uncommon in my family for my wife, my daughter, and I to all be sitting in the living room. We're all looking at a each of us have our own laptop, and we're looking at our laptops. My daughter and I both have our cell phones going, and we're doing different things on our phones, and we have a TV screen in the background. So that's 6 or 7 different devices all going at one time. That makes us a very difficult audience to slow down and engage. And one of the ways we can go out and slow down these audiences and capture their attention is to appeal to their areas of interest. What interests them? And that's the notion of community. People gather based on shared interests. Whether it's you're getting together with people at a church or people in a community group or people who have a hobby or people who like hockey or whatever it happens to be, people are drawn together by common interests, and they form communities pretty readily around those topics. So I propose that community building and a community building mindset is a great way to go about starting to engage healthcare consumers, get them interested in their health, but specifically interested in aspects of health that appeal to them and that are relevant to them at this moment in their life. Because if you think about it, most of our healthcare marketing is irrelevant. My friend Chris Bevelow wrote a book called Joe Public Doesn't Care About Your Hospital. And he's absolutely right. When we're advertising hip replacements or whatever it happens to be, whatever service for a hospital or some kind of healthcare practice, unless that consumer is interested in that particular issue at that very time, so unless they're having hip pain at that time and you're advertising something about hip replacements or orthopedics, then that advertising is irrelevant and they're not tuning in because consumers typically don't want to be thinking about healthcare. This isn't top of mind with them. What they are thinking about is their own wellness. They are thinking about living a long life. And those are things we can talk to them about. But so most of the time when we're doing service line marketing, we're just spending money and throwing messages at consumers, and 99% of them out there don't care about those messages. So with the final slide from the Real Simple and Huffington Post survey, when using social media, what was the benefit to these women? What was the value? Well, they felt connected. They felt entertained. They felt informed. They felt inspired. And some weren't inspired. Some were bored, and they need to get off social media and take a break. But generally, there was real value here for the audience. And that's what I want all of us to think about when we're doing marketing. What's the value to the target audience in the messaging that we're putting out there? In our content strategy, when we're thinking about putting something out there on any platform, what is the payoff for the end user? What's going to engage them about that information? Are you entertaining them? Are you informing them? What need are you meeting? And I think that's essential. So with the new reality of population health management, we're all going to be in the position of needing to engage consumers far better than we've done in the past. We have to get them engaged in their own health, get them interested in their own health. We've been in this world of episodic care based on these acute episodes and not in a long-term commitment to engaging people and involving them in a journey, which is a journey towards better health. So we really need to reform the way we've marketed, because we really marketed in a way that speaks to that episodic type of health care, and that needs to change. We need to move away from marketing at women, where we're just spewing this content. And I say women because most of the time in healthcare, women are the decision makers. They're caring for their children, for their husbands, for their spouses, and for their parents. So stop marketing at them and throwing messages at them, and start engaging them in conversation. Start involving them, empowering them with information, interesting them, appealing to what's of value to them. That's the way we need to think. So I want us to make an investment in community building. And I think if we approach our jobs as community builders, if each of us goes to work every day in our organization and say, instead of pushing messages out at consumers, we want to build communities of shared interest. We want to identify areas of interest and bring together people who have that same interest, share information with them within that context, listen to them, because I think that's a huge thing that's been missing. We aren't remembering to listen to these audiences. And then once we learn from them, share with them more information that they tell us they want. That's a formula for success. And it will certainly deepen their engagement with our brands. And it will feel so much more authentic than the advertising that we've been doing. Getting information within an online community, and I'm going to talk a lot more about building online communities, but getting information within an online community where there are other people out there who've been through the same kind of experience and they're all sharing, that's a context where information sharing is very authentic and credible, versus just going on our website where it feels like marketing, frankly, and it's overwhelming. There's so much there. They need to be able to stop and ask questions and have us provide answers. So in this relationship with consumers, and that's what it is, it's a relationship, it's two-sided, it's give and take. We need to provide value. We need to say, how do we enrich their lives through the communications and the communication platforms that we produce? So what does value look like? Well, you saw with the Huffington Post survey, things like entertainment and information are vital. I did a e-patient panel at the recent conference of the New England Society for Healthcare Communications just last week, and we had 3 patient advocates there speaking about their experience, and one of them made the really important point that information is the most important commodity when you're talking to patients. They want information. There are lots of other things they want too. They want to be able to tell their stories. They want to be able to engage with others who've gone through the same experience and learn from them and share with them. So there's this sense of isolation that patients often feel, and they can get through that by coming to communities and finding others like them who've been through the same thing. That's very empowering to find those kinds of people. These communities give them an opportunity for self-expression. That's a great value, and the opportunity to be heard. And we're all looking for emotional connections one way or another. That's often why viral videos are so powerful, because those videos that go viral are often the most emotionally engaging. So all of these things are qualities that can be present in an online community. And we'll talk about what types of communities there are out there. Toby Bloomberg, who's just terrific, wrote this quote, and I just love it. As long as women feel safe in a community, they will feel free to express their personal viewpoints, which adds authenticity and attracts other women like them, increasing a community's value. That's exactly it. Our job, as I see it moving forward in healthcare marketing, is to create these spaces, these online environments, whether it's a Facebook page or a Twitter chat, like the breast cancer social media chat that happens every week, or an online patient support community for people with diabetes. Any of those examples. Our job is to create these environments where people feel safe coming and sharing information, and they know that they can get valuable resources and information that will help them on their journey to wellness, or whatever path they're following. Hopefully it's a path to wellness. The elements you want to find in a community, and there are more than those I've listed here, but these are the top ones that come to mind. This notion of reciprocity is really important, and I listed it first because reciprocity is missing in so many things that we do today in healthcare marketing. When social media first came around and hospitals slowly came on board, getting on the bandwagon, adopting Facebook pages and Twitter feeds, the mistake that happened is that they started treating these social media platforms just like they've always treated other mass media vehicles. And my point is that these are not mass media vehicles. These are niche marketing tools. The power of Facebook or Twitter comes in being really targeted. And again, going back to this notion of shared interests, having a very select interest group there. So if you have a Facebook page, make it very targeted. For instance, you've got your if you work for a hospital, and a hospital has their general Facebook page. If you're a patient with bariatric issues or a person with bariatric issues, do you want to go on and talk about bariatric issues on the hospital's main Facebook page? Or would you rather go to one that's dedicated to that topic, where there are other people who've already been through bariatric surgery and they can talk about their experience and share their input? Where there are people who've opted not to have bariatric surgery and they'll tell you why, and they took another path. I think that's a far better solution. Do cancer patients want to go on and talk about their experience and try to connect with other cancer patients on the general Facebook page? The answer is no. And it's not a lot of work to create a targeted Facebook page where it makes sense, where you've clearly identified there's a group here who have a shared interest and they want to get together, and there's value in bringing them together and having them share their experiences and bringing your clinicians and your health information to that conversation. And they will welcome that expertise. Some of the other elements of community are listening, and we need to do a lot more of that. All these social media platforms are great listening platforms. If we're not using Facebook and Twitter and LinkedIn and all of these platforms to listen and learn from these patients and their family members, then we're really missing a huge opportunity. By listening, we become better marketers and better clinicians. We need to show that we value the opinion of others, and I'll talk a little bit about that more, how we do that. We need to be supportive and find support, both emotional and informational, within communities. I think there needs to be a spirit of kindness and civility, and if you're a community manager, you need to strive to keep the conversation at that level. And then it's wonderful when you can have a feeling of being valued, that people actually appreciate what you're putting out there in the community, and they show you that by reciprocating and thanking you. So those are some of the elements of community that I look for. And what kind of environments am I talking about creating? What kind of communities? Well, blogs are a great place for this to happen. Social networks like Facebook. Facebook is ideal, and I'll outline some steps for doing this on Facebook in a minute. There's, of course, true online patient support communities like you find on Inspire.com. Patients Like Me, there's dozens and dozens of these. Inspire.com, they've had 5 million plus blog posts written by patients. These are members of Inspire.com. And they're broken out by these select communities based on different chronic conditions and disease states. And of course, your website. I mean, let's not forget, our websites can be engaging. They can be inviting environments. They can be environments that actually encourage conversation. Unfortunately, most of them don't do that, but it certainly can be done. There's no reason it can't be done. So communities allow us to learn from our constituents. It's really important. Keep listening and learning. The new role for marketers that I've identified is creating these environments that allow for healing and sharing, and then taking advantage of those environments to actually share information about our organizations and the different services we provide that are relevant to that niche group. So this is really a fundamental change where we're going from professional storytellers, and let me tell you, the storytelling element is not gone. We're still storytellers, but it's just not everything we do. Now we need to see ourselves as these community builders, managers of communities, facilitators of conversation, relationship builders, and then content generators and curators, but not content generators first. That follows. First, we want to build community. And it's this notion of hive marketing, and I love this this vision of a beehive, and you have all the bees buzzing around it, and for me, that's a targeted Facebook community. You've got all these people coming to this Facebook community to talk about weight loss and wellness or whatever the topic is, and they're buzzing around, and you're helping feed the conversation, you're helping facilitate people meeting one another, you're asking questions of the group. people are talking, you're bringing your clinicians to the table, having them add input, and people are leaving that community periodically and going out to the rest of the world, whether it's social world or seeing people in person, and they're talking about this extraordinary experience they're having and what a great resource this is online. And they're spreading the word, and it's like bees leaving the hive and then bringing other people back with them to come check out the community. That's a wonderful form of marketing. That's modern-day word-of-mouth marketing, and we need to do more of that. And if we can segment these social media platforms and capture people's imagination, not make them too broad where they're just irrelevant, but make them very focused so they really have meaning. They won't have meaning to everybody, but they're going to have meaning to enough people who are truly interested in that subject to make it relevant and compelling. So, as evidence, online communities for women are everywhere, and health is one of the leading topics you find in these communities. People are flocking to the web to join these communities, to participate in conversations, to build relationships. It's amazing. Here's a screen full of these different organizations, everything from Disruptive Women in Healthcare to Empower Her to Hot Flash Havoc. It goes on and on. There are dozens and dozens of these organizations. You should check them out online, and you can get very focused. You can find organizations just for women 50 plus. It goes organizations and sites for women who are boomers. You can break it down any way you want. I'm just going to show you a few of these. Speaking of women's health, Disruptive Women in Healthcare, Empower, Fab Over 50, this is one of the over 50 groups I was mentioning, Flourish Over 50, Vibrant Nation, another 50-plus group. So you can see it goes on and on. There's an online community for everybody with every interest. And they are clearly meeting needs, or they would not be flourishing the way they are. And we need to get on the bandwagon in healthcare. But it doesn't mean we have to create these online communities. We certainly can, and I have clients who are doing this right now. And I think it's a really smart strategy. But you can start with your own website, and you can start with your Facebook page and your Twitter feed. But let's look at Facebook for a moment and thinking about this notion of approaching Facebook every day. Instead of saying, okay, what am I going to post on Facebook? Saying, okay, I'm a community builder. What am I going to do with Facebook today? What are we doing in this community? How am I building community and engaging people? That's a really different way of thinking about Facebook. And I think if you think about the analogy of a dinner party, it changes, again, the way you look at it. And it's so simple because we all know how to have a dinner party. We've all invited friends over, whether it's a dinner party or just having people over to cook out or for drinks. You know, you think in advance about who are you going to invite? What are they going to have in common? Oh, we can't invite this person because he's not going to get along with these people. You go through that process in your head and you say, okay, let's bring these people together because they'll have commonalities, they'll have things to talk about, we think they'll get along. So that's step one. When they come to your house or they come to your Facebook page, you welcome your guests and you make introductions. You facilitate that introduction process, and that's exactly the way it should be on Facebook. You want to recognize people who start following you on Facebook, who come and comment or like things on your page. You really want to be gracious and welcoming and go out of your way, and that means being vigilant. You facilitate conversation, and that means, you know, you get that awkward pause in a conversation when you're having a dinner party or you're out at a restaurant with a group, and those people who are more socially savvy think of a topic and they say, hey, what do you guys think about this? Or they'll say, hey, Jim, didn't you do that thing last week? Tell Sue about that because I think she'd be interested. And you try to get that conversation flowing. You use those same skills on Facebook. You do those same type of activities, and it will make your Facebook page so much more successful. You'll find people are suddenly talking because what you want to do is model conversation and model community behavior. Because you'll notice on Facebook, people are really shy about commenting typically. They don't just come to your wall and want to leave comments. They might like something, because liking takes very little of initiative or effort. It's not a lot of engagement to like something. You just go like, and go down the list. What's meaningful is to get them to participate in conversation and start commenting, and that feels a little bit uncomfortable. But if they see other people doing it and they see you asking questions instead of just spewing content, they say, hey, this is an environment where it's safe to leave comments. It's expected. It's part of the norm. And they'll start doing it. It's amazing. I mean, we will have friends go on a Facebook page and leave comments just to start modeling that behavior, so the people we're targeting will see that. And it's amazing how a very quiet Facebook page, once a few people start commenting, will really come alive. And that's what it takes. So you work to involve everyone in the conversation. You fill those awkward silences, and then you thank them for their participation. You recognize it. And then not only does that say you're appreciative and you're gracious, but it also says you're paying attention, that there's somebody out there, that this just isn't a marketing tool, that this really is a community where people are going to respond in a timely fashion to your questions. One of my pet peeves with Facebook is when a patient comes on a Facebook page or a family member comes on the Facebook page and asks a question and nobody responds. Whether it's positive or negative, you need to respond and show them that you're paying attention, you value their question, and you're going to get an answer for them even if you don't have it at that moment. So keys to building a Facebook community: segmentation, trying to break it out and keep it interesting based on a niche audience, feeding the conversation. Profiling clinicians or other healthcare workers is a great way to generate comments. People are really excited when they see a video of their favorite physician or favorite nurse pop up on the Facebook page, and they will comment about that. That's actually one area where people are more than willing to comment. And then the beautiful thing about that is other people who are part of that community see others commenting about this particular clinician. And they may not have heard great things about this clinician. They may never have heard of the clinician at all. And suddenly they're saying, oh, Dr. Smith, look at all these people saying nice things about him. And it's really positive. And in this age where people are leaving online reviews on things like Angie's List and Yelp and every other service you can imagine, it's so nice to generate your own positive feedback on your own platform, so that people can see that your clinicians really are liked and appreciated. So that's a strategy we use, and we've had great success with it. Encourage discussion, and again, the best way to do that is, one way is to ask questions. So few people will actually go on their Facebook wall and ask questions of the people who belong to that community. I think, frankly, they're afraid no one will answer. Well, you can seed it and have some people answer it for you, and that will lead other people to answer as well. But definitely respond to comments, thank people for their comments, ask follow-up questions. Remember, a conversation isn't question and answer. A conversation is question, answer, and you listening, and then asking a follow-up question, being engaged. That's a conversation, that's a discussion, and that's a community. So think about that when you're reviewing people's comments on your Facebook page. So I was doing some research for a pelvic health conference where I was speaking last year, and I was looking at different pelvic health programs online. And obviously pelvic health is an area where I think women who are talking about pelvic health issues would really enjoy having a private Facebook page, whether it's private or just dedicated to the topic of pelvic health. Either of those is fine, but if you're talking about pelvic health pain, or pelvic pain, or pelvic prolapse, those kinds of things, urinary incontinence, you don't want to do that on the main hospital Facebook page or ask questions about it on the main page. You want a dedicated page about pelvic issues. So I was really excited when I found this particular pelvic health program at Reading Health System, and I saw the little Facebook icon up at the top, and I thought, finally, someone gets it. They've created a special Facebook page just for their pelvic health program. So I was excited. I clicked on just like a patient would do, I clicked on the Facebook icon and found it was just their general page. So it's not just a fail, but it's a big fail, because a patient might be hopeful, just as I was hopeful, that they're going to suddenly find a home where they can find others who are dealing with the same kinds of issues. And these are annoying issues. So they're going to find others with these same issues that they can talk to and get advice from, and maybe just get a sympathetic ear from. But instead, they get the general Facebook page for the health system, and that does them nothing. So it's a disappointment at best. And this is what I want to avoid. There should be a Facebook page for their pelvic health system, and we need to get to that point. So blogs are also something great for community building. There's a wonderful sense of community within many blogs. People feel like they come to know those different writers for the blogs. They have comments. They exchange in conversation. The Blogger Network is a great example. There's over 3,000 blogs within the network and over 55 million readers. It's a really successful platform. One thing my firm has done is we've gone out and created blogs for hospitals to allow them to do this kind of community building and engagement. And in particular, we've continued to target women. Some of the blogs we've done are specifically for moms. Some are for moms and dads. And some are for just women of different generations, because that multi-generational messaging is really powerful in this day and age. But this is an example of the Signature Moms blog that we created for Signature Healthcare and Floating Hospital for Children, just south of Boston. And this blog, we went out and we recruited 8 bloggers from the community. These are women in the community who write these blog posts. Each one writes 2 blog posts a month. And it's been spectacular. Each one, if you think about it, each one of these bloggers might have 400 or 500 Facebook followers. So not only do they come to the community, but they bring their Facebook followers with them. In 2012, which was the first full year of the blog, we had 42,000 visits. In 2013, we had 64,000. And today, it's over 160,000. It was 149 when I typed this, but it's over 160,000 visits today total. And the most important thing to me is the number of subscribers. Blogs have a really hard time pulling in subscribers. People kind of just tend to drop by or add them to a reading list, but they don't subscribe to the blog. And this blog has 2,500 people who've said they've opted in, and they get an e-blast every time one of these women writes a new blog post and shares some content. That's just truly remarkable. It's a wonderful success story, and it's meant great things for both of these hospitals that have partnered on this. It has engaged their community. It has immersed them in the community, and they add blog posts from the hospital, from their clinicians periodically to insert good health content. But in general, 9 out of 10 blog posts are from these moms in the community. And what this says to people who come to it from that area in southeastern Massachusetts is here are 2 organizations who understand my life. They understand how busy I am and that it's difficult to connect with other moms, and this gives me the opportunity to do that and to share information with other moms, which is a big value to me. And that deepens their engagement with the brand, so it's invaluable. Here's just a snapshot of some of the actual data from the blog. So in 2014, we're tracking well ahead of the traffic we've had. It's just continued to build, and it is a tribute to the women who write the blog posts week in and week out. It's just phenomenal. And for the hospitals, it's wonderful because they don't have to write the blog content. For the most part, most of the hard work is done by the moms. We do some editing and we post them, but it is not a lot of work. Another blog we manage, and definitely a community, is for Lexington Medical Center in Columbia, South Carolina. They have 8 bloggers. We use the same model to recruit these bloggers from the community. We did a Facebook contest to recruit them, and women submitted their rationales on the Facebook page for why they would be great bloggers. And it's taken off, and this is a multi-generational blog, so these are not just moms. These are grandmothers, mothers, cancer survivors, people with all different kinds of stories, young women who are yet to become mothers or may never become mothers. but they've had a ton of visits and over 700 comments in the first 2 years of the blog. I love El Camino Hospital. They're not one of my clients, but I just think they've done a great job of both blogging and making their hospital website more engaging and feeling more like a community site. If you look at this page from their website, and again, I was doing research about pelvic health and came to this page, and here's a video from Nurse Barb, one of their nurses there. This is a real woman. She's not just a marketing person. She's a nurse practitioner. And they look at the little icons out to the right of the video. They have this big icon for her blog, The Daily Dose, but they have an option where you can contact her by email, you can live chat with her, or you can call her. Again, it's taking what used to be a static website, very much a flat marketing piece that isn't very compelling, and suddenly it's turning it into a place where you can have a conversation. And that's very different from what most of us do with our websites. So there's just a close-up at the icons. And here's Nurse Barb's blog. So if you click through to her blog, she's a real person. It's very inviting and friendly looking. It's not clinical looking or sterile. It's got a welcoming feel to it. And it's authentic. And you can learn from Nurse Barb, and she's going to give you straightforward advice. So I really like what they've done here. This is the direction I think more of us need to go with our websites, inviting the audience in to a conversation rather than just, again, putting information out there for them. So the evolution of all those groups for women I showed, all those online communities, is online patient support communities. And there are hundreds of thousands of people who belong to these online communities focused on very specific health issues, who are there to find support, to find information about whatever disease or chronic condition they might have or their child might have. It's just a remarkable movement, and it's one we need to be responsive to in our healthcare communications efforts. These online patient support communities, Lori Edwards, who's an author and an instructor at Northeastern University, wrote this book, Life Disrupted, and it's about her experience with chronic illness, but she also interviews other people who've been going through chronic illness. And this quote I just love. She says, the proliferation of web forums and discussion boards and medical blogs all speak to our inherent desire to seek out those like us, to affirm the symptoms and aberrations we've finally found a name for, to assimilate into a community when we felt isolated from the larger world of the healthy for so long. I mean, when you're sick and you're seriously ill, it is powerful to find others like you and to know that you're not alone and to find out that others have tried different things that you're thinking about trying. They've maybe met with doctors that you're thinking about meeting, and they can make recommendations and they can support you, even if it's long distance and virtual. There's great power in that, and I strongly recommend both of Lori's books. They're both about chronic illness. She's wonderful. She said, when I was finally diagnosed, it was very important to me to find other people with my problems. This is exactly what we're talking about. Determined to find a community, however remote or far-flung it was. I read all the discussion forum threads in earnest and even posted now and again. Story after story dealt with misdiagnosis, our narratives included many of the same details. This is like reading my life story, I thought, over and over. It's powerful. These communities offer something really important to patients. And this is something we can be doing in healthcare marketing. It doesn't have to be left up to nonprofits or to health insurance companies or pharmaceutical companies who are very quick to move in this direction because it provides a platform for them to market their drugs. So here are some examples of just a few of these patient support communities online. The Osteoporosis Foundation, Inspire.com, which I'm a huge fan of. Patients Like Me is probably the largest of any of these. They've got dozens of online communities, very focused. Rare Connect for rare disease community, and this is so powerful because these people all over the world with rare diseases, where there might only be 400 people in the world who have what you have, and in the old days, the odds of connecting with one of them was impossible. It was so minimal, but now you can join one of these communities, and suddenly there they are. dozens of these people going through the same thing who can give you advice and education and information and support. NORD, the Diabetic Connect, there are lots of communities around diabetes. And then here's one we're actually in the process of building right now for one of our clients, Signature Healthcare. You can see the stock photo is still in the image because it's just a comp. But we are building this Care to Share community, and it's a chance for patients and family members of the hospital to come in and share their stories and connect with other patients and other family members who might be going through the same thing. And it's a powerful platform. You can go to this platform, create a profile, upload a photo, upload a video, type in a narrative. You click on a little HIPAA icon in order to sign a HIPAA release and to waive your rights, basically, your HIPAA rights. It's a really neat opportunity. And it's again, this sits on their website, so it's a chance of turning their website from something very static and just informational into something very conversational where patients can actually contribute to it and have conversations with others. And this is just where they submit their story on the website. Twitter chats are another area that I don't think get nearly enough attention as a great opportunity for community. When I was doing that patient panel with the New England Society for Healthcare Communications last week, one of the panelists was one of the founders of the Breast Cancer Social Media Twitter chat, which is a chat for breast cancer survivors and the entire breast cancer community. And it happens once a week, and they have about 200 participants in the chat. And one of the points she made, it was Alicia Staley, and she made was that this is a community. I mean, we are tight. We support one another. And one of the things I love about this community is they brought clinicians into the community, and the clinicians inform the conversation. And when something really strange comes up, like the discussion of some strange new cure, the clinicians can chime in and lend their expertise to the conversation, which I think is really important, because when you're talking about things like cancer and AIDS, these miracle cures, there's always rumors on the internet of different miracle cures that pop up, and it's great to have the clinician right there to lend their perspective and expertise to the conversation. So this is a screenshot of some of the participants from the Healthcare Leader Twitter chat that happens every Tuesday evening at 8:30 Eastern Time, and it's a great chat to participate. Anybody's welcome. Any of you listening today can come to this chat. And what I love about it is it's so multidisciplinary. There are doctors, nurses, patients, marketing people even. There are hospital administrators, patient advocates, public health workers, and it lends itself to just a really interesting array of opinions and conversations. And we post prior to the chat each week, we post a discussion on the blog for the chat, and it gives the topic for the conversation, and it gives the 3 questions that we'll touch on over the course of the hour, so you can use that to prepare for the chat. And then we have the live chat at 8:30 on Tuesdays. But it's a wonderful group, and it is definitely a community. I look forward to it every week, and it's like reuniting with old friends every time I can make it. And I can't make it every week, but I'm thrilled when I can. And you can see from this some of the data that comes from this. This was a slow week. There were only 100 participants, and it generated more than 3 million impressions over the course of an hour. I mean, it moves very fast. There were over 1,000 tweets in just that hour with using the hashtag for healthcare leaders. So it was remarkable, and it's that way every week. And here is a screenshot of some of the breast cancer social media participants in that chat. Another really vibrant community. And they're in the same range. They have about 200 participants a week, and about 3.5 million impressions coming from their discussion. So I definitely recommend checking out these Twitter chats, because patients are turning to these more and more as a way of engaging others. And if you look by topic area, there are all kinds of health issues that are being dealt with on these Twitter chats. And finally, your website. And I've mentioned this before, and I showed El Camino as an example of a website that's moving in the right direction. They don't have a beautiful website, but man, they have a website where patients feel like they're invited to talk, invited to be a part of the discussion, and that's just important. Here here's I hate to say it, but I think it's a fairly typical physician finder page with a horrible black and white photo of a physician. I see these sometimes where there's just the outline of the head of a physician and says no photo available, which is, I think, a horrible sin and should never be done. If you can't get a photo of the physician, don't put the physician on there until they sit down for a good photo. But I think this is not the way people should select a physician. You talk about community building. There's nothing inviting or warm about this. How about a community might say, if you're thinking from a community mindset, you'd say, I want to meet that physician. Perhaps the hospital might introduce me to that physician by way of a video. So wouldn't it be more compelling to have a 45-second or 50-second video of that physician in color speaking to you? And you might not like that physician, and that's okay. I mean, not everybody's going to be a perfect match. There is some chemistry that's involved or should be involved in selecting a physician. You want to select someone that you're going to have a positive relationship with, that you're going to feel good about sharing information. You're going to want to share information, and you're not going to be withholding information like many of us do from our physicians. So I think the opportunity at that moment when you're selecting a physician, there's no more important decision that you're making. So let's give these people some real quality information and a quality experience when they're trying to select a physician. And one of the things we'd like to do is actually produce physician video and use that as a way to engage consumers, because there's so much more emotional impact. Emotion is one of those values. So we work to make sure, rather than just having a static photo, we actually have a video. And here's Dr. Michelle Finkel from Signature Healthcare. And I'm sorry the audio won't be great, but I'm going to do my best to make sure you can hear the video as well as see it. But I want to play you Michelle's video, and she's a young OBGYN building a practice, and we needed to introduce her to potential patients. So after this, we hope people see the video and say, yeah, you know what, I could work with her. So here's Dr. Michelle Finkel.
I think that my patients will recognize right away that I have an outgoing personality. What they might not know about me is that I love to run. I've run the Chicago Marathon, and I've run the Falmouth Road Race, but it's my favorite pastime to get out there, hit the road, and relieve some stress. I'm Dr. Michelle Finkel, and I am an OBGYN at Signature Healthcare. Delivering a baby is the most incredible experience in the world. It's the main reason I chose to be an OBGYN, and I have to say that every experience is unique and positive in some way, shape, or form. There are several times where I feel like I am almost brought to tears because it's so great, especially when the dads cry. That really gets me. I believe that educating patients on their own health is just skimming the surface of what I need to do to make sure that I'm being a good physician. I believe that my job as an OBGYN is to give my patients the most up-to-date, accurate information so they can make the best choices about their health. As an OBGYN, I do serve as a primary care physician, and I do see all age groups, everyone from age 13 to 65 and above. In addition to just asking Mrs. Smith if she's exercising, I think it goes above and beyond that if you ask her, what does she like to do every day? Who could she exercise with? Has she exercised in the past? Does she hate exercising? Do we need to talk about something else? I think the more you know your patient, the more you can actually get them to go above and beyond me telling them they need to exercise, and actually get them to do something that they might actually enjoy and make a difference in their everyday life.
So that's Dr. Michelle Finkel. And, she's not going to be for everybody, but at least whoever it is who's trying to select an OBGYN has the opportunity in watching that video to decide, do I feel good about Michelle Finkel? Is she somebody I want to meet with and perhaps consider being my new OBGYN? And that is far more valuable than the typical find a physician page where you've got bullets from somebody's CV and you've got that headshot. That's no way to select a physician. So creating your own communities, obviously you can do it with Facebook. You can set up private Facebook groups, which lots of hospitals do. You want to have that bariatrics group, go ahead and set up a private group where people have to join the group and be accepted into the group, and not just anyone can just drop in. You can use a service like Ning to create your own communities. And again, they can be private. You can start a platform on a service like Inspire.com, or you can use something like SharePoint. There are lots of different ways. Even WordPress has its own community building themes that you can use. I think one is called One Community. So there are lots of different ways to do this. You can start a blog and do it on WordPress and do it for free with no output of cash, and you don't need any design capabilities. So lots of different ways to do this. I have my own healthcare marketing community online that has now over 700 members. And they're great people, and it's wonderful. I can connect with them just by pushing a button, submitting a blog post, and each of them can submit their own blog post to the conversation. So it's a fun thing to do, and it's meaningful to me as a healthcare marketer to have access to all those people at any one time. And I have the same access to them through Twitter and LinkedIn, both community platforms for me. So in marketing your community, it's really important, whether it's Facebook or a patient support community or a LinkedIn group, which is a whole other way to build community. Understand that slow is normal. It doesn't happen overnight. Quality is more important than quantity. It's better to have 10 members who are engaged and actually talking to each other than 500 who've clicked like on your Facebook page one time and who have never come back. Quantity is bad compared to quality. Go for quality, and quality will eventually draw in others. It will grow, but just manage expectations. Don't tell your leadership team you're going to have 500 contributing members overnight, and don't let your leadership team think that it's about the number of members. It's not. It's about the number of people who are engaged. You want metrics that measure engagement, not just numbers of likes. Tools for promoting your community. Use your website to promote your community. Use social media platforms. If your Facebook page is what you're trying to really focus on, use Twitter, use Pinterest, use all these other platforms to promote what's going on your Facebook page or what's going on your blog. When I was building my blog initially, I used LinkedIn to promote it, and it was a wonderful tool for that. Signage within your facility. You can use old technology and old communication platforms to market new media platforms. It absolutely works. There's no problem. If you've got a blog, you can run print ads promoting your blog and sending people to your blog. And as much as I hate QR codes, you can put a QR code in there in your print ad and have people just easily snap that image and go straight to your blog and then like your blog or join the conversation. So there are lots of different ways to do this. So don't rule out those traditional tools. There's still a place for them. And remember, above all, this is about communicating with people of shared interest. Don't try to talk to a mass audience. Get focused. There is power in being focused. And then think about that dinner party. Think about being welcoming and engaging, and reciprocate when they offer things up. Feed them with good information. There's no problem with putting good content out there once you've taken the time to find out what they want. And if it's focused content, that's the right place to be putting out that kind of content and to be offering up your clinicians as experts. But go ahead and position your organization as a resource. And that you share their passion for this subject, and certainly your clinicians, those specialists in that area, share their passion. This is their life. They've dedicated their careers to this issue, whatever this topic is, and so there's a shared interest there for sure. So take that opportunity to bring them together, and then let these people become your ambassadors. Let them go out and tell your story through word-of-mouth marketing and invite others to come to the hive. So that concludes my presentation. Thank you all for being here, and I'll throw it back to Joel at Medicom and see if Joel has any final comments or thoughts.
Great. Thanks a lot, Dan, and I really appreciate the takeaways that you had at the end. If anyone has any questions, again, please use the chat feature and go ahead and send us questions and we'll answer them. And if you do not follow Dan on Twitter, someone I'd definitely recommend following, as well as his blog, which he has listed there on the screen, The Healthcare Marketer. Very good insights. He's definitely known in the industry as a thought leader, so someone definitely worth following. And then Jennings, too, certainly check them out. I know they do good work. Last week I was at a conference, and their clients won over 30 awards for different campaign pieces, so they certainly do a good job. A couple questions, Dan, that came up. Do you have any health systems that you've ran across, whether your clients or others, that you feel does a good job at building these communities?
Well, Joel, it's a good question, and there are lots of health systems that are dabbling in this. Mayo Clinic has their whatever they call it, Share Mayo Clinic, but Mayo has their online community, and it was built by a company that we work with, actually, a technology partner of ours called Care Hubs. And if you go to that community, you can, first of all, you can share your own patient stories with Mayo Clinic, which is cool, which is exactly what we're doing with Signature Healthcare. But they also have sub-communities. So if you go to their general online community for patients and family members, you then can click on a list of sub-communities by topic areas. So it might be hypertension, ovarian cancer, arthritis, and so on, and you can click on those little sub-communities, go to them, join those communities, create a profile, and then take part in the online forum, the conversation that's taking part there. So Mayo's doing a good job with that. I think where I've always felt that particular community comes up short is they aren't doing enough to engage, to bring their clinicians and all their expertise, and they have a wealth of expertise they could bring to the table, but they aren't bringing those to the community. You basically have to leave the community and go back to the Mayo website in order to access information about it. If you're an ovarian cancer patient, for example, to access information about ovarian cancer. So my vision in the communities we're now building for our clients is to try to bring that all together under one umbrella, so that you're bringing that clinical information and the kind of health information that people in that community value and want. You're bringing that to them. You have videos of your physicians talking about those particular issues. But if anyone wants to email me, I do have a list of some of the different organizations who are doing this well, and I'm happy to send it out to you and point you in the right direction, certainly.
Okay, excellent. And then, as we know, hospital marketers, their time and resources are very limited. If there's just one thing that you would recommend that they would do to begin this community building process, what would that be?
I would start, I think it's somewhat evident from where I put my emphasis in the presentation, I would start with Facebook, because Facebook is a platform that people are comfortable with and they understand. And I think that's the place to do it. So I think you could do two things without having to go, overboard. One is make your general Facebook page more interactive and more compelling. Actually work to generate comments, to have conversations with the people who join, because you can have that broader community there, certainly. So make that main Facebook page better using the kind of principles I've talked about in this presentation. So that's number one. You're having a dinner party with your Facebook page. The second thing I would say is then experiment. I would go out and create a second Facebook page. I would pick some kind of subspecialty where your hospital has a lot of patients, where there's a lot of interest. A lot of my clients right now, my firm's clients, are putting a lot of emphasis on bariatrics. Obviously, obesity is a huge issue in our nation. So maybe experiment with creating a bariatrics community. I mean, it's perfect because a lot of these hospitals are having these information sessions. They're advertising these information sessions. But these people, they come to the information session, and maybe 2 out of 30 or 5 out of 30 take the next step and get more information and follow up with a surgeon or whatever. But the other 25 are still thinking about bariatric surgery. They just aren't doing anything with your hospital at that moment. If you have a bariatric dedicated Facebook page and maybe a private page that you can give them information about at that information session, then they can leave the information session and do research online on your community. They can meet other people who've already had bariatric surgery at your organization. I would put up videos of your patients who've had bariatric surgery. So pick one service line like that, whatever it might be. It might be a particular cancer subspecialty like breast cancer or ovarian cancer or a cancer survivors group. But pick one and try that. So make your main page better and then pick one niche area and try to blow that out and be successful with it and build a community around it.
Okay, excellent. Well, that's it for the questions that we had. So Dan, as always, thank you for your expertise, very enlightening. And thank you everyone for your time today. And if there is any questions, please feel free to reach out to Dan or myself, and we can answer them then. Everyone
Thank you, Joel.
Yep. Thank you.
Take care, everybody.